Hey, I'm Dr. Jake, a physician who makes videos about medicine and pop culture, and today I'm watching Spongebob Squarepants. Before I start, I'm a doctor, but I'm not your doctor, and none of this video is medical advice. Let's dive right in.
This is nice.
Never fear, Squidward. Soon this dreary old room will be so full of well-wishing you'll never want to go home.
Oh,
5 minutes later.
SpongeBob, get this garbage out of here! I can hardly move!
The issue that I see with SpongeBob bringing all this stuff is that falls are a huge issue in the hospital, so if you clutter up a patient's room, you're gonna put them at risk. I would strongly suggest that if you're gonna give anything to someone who's in the hospital, get them a card. They're not gonna trip on it, and you can show some creative flair.
Hello, lady. Can I be your candy striper here at the...
Grab a uniform out of the closet.
Oh, thank you. Thank you. Wow.
This cannot go well.
Oh, candy stripes.
Candy stripers actually don't have anything to do with candy. They were volunteers who worked in the hospital, and their uniforms, like SpongeBob's, were striped. Unlike SpongeBob, you'd have to do a couple of trainings and probably go through a background check to have access to patients.
And what seems to be the problem today?
My throat hurts!
Wait a second. I think I've seen this before. Yeah.
I don't care if you're a doctor or not, you shouldn't be licking detritus off of your patient's chin.
What treatment might you prescribe for this next patient, doctor?
Those fractures are nasty. One of the big problems with fractures in the non-bikini bottom world is that they bleed a lot. Your bones all have a ton of marrow in them, and they are also hugely vascularized. Lots of blood vessels pump blood into your bones because they have to grow, they have to heal. So I'm surprised that this fish with all of those crushed bones didn't die from these injuries.
Hi, Mrs. Pop.
No, not you.
I would feel the same way.
Don't worry, Mrs. Puff. I'm a doctor today. What is this crazy thing?
If you are not a physician, an MD, or a DO, do not pretend to be a doctor in the hospital. That is a criminal offense and you can get in a lot of trouble. In 2019, a University of California Irvine student was sentenced to a year in jail for impersonating a physician. And I don't think he even did any harm to patients. Imagine if you actually hurt someone. You'd feel bad, and you'd probably go to prison for longer.
Oh boy, surgery! And on my first day, too.
SpongeBob, no! What are you doing here?
Naughty not, Mr. Tentacles.
Wait, no.
Probably propofol. General anesthesia can suppress your upper airway muscles, the ones that, help you breathe. So if you're gonna get general anesthesia, you usually need a breathing tube.
Oh, we're most eager to see which tool you select first.
Why aren't they wearing masks? You need a mask if you're doing surgery because every single tool that you use to cut into a patient's body or manipulate the inside of a patient's body has to be sterile. And if you're breathing on them, they're no longer sterile. Also, none of these doctors scrubbed in before they entered the OR. When you scrub in, you're basically cleaning yourself off so that you don't contaminate the patients or any of the instruments.
This can't be too hard. Just make an incision here. No! Son of a gun! Not my bad.
I'll take that.
Aha! Sushi.
Oh no. Food is definitely not allowed in the operating room. By the way, if you're enjoying this video, please make sushi out of the like button. These videos take 20 to 30 hours to make, so your boosting me in the algorithm would really mean a lot. Thank you. I was in a case, and I wasn't the surgeon because I'm not a surgeon, and the surgeon left a sponge inside of the patient. They left a cloth that was used to dry up blood inside the patient, and the patient had to be reopened to take that out. And to prevent that, they do careful counts of every single surgical tool and sponge and piece of gauze to make sure that they're all accounted for.
Ow! That shouldn't be in there. Ooh.
What?
Oh God. Unfortunately, that one rings true because people of all ages love to put things in their noses. In fact, if there is an orifice, people will put things in it. And the weirdest thing I think I saw was a Lego in the nose. The most dangerous thing I've seen put into someone's orifice is probably a battery. If you swallow a battery, that battery can cause severe burns in your esophagus. The other thing that's troublesome is when people swallow magnets. Now, if you swallow just one magnet, it's okay. But if you swallow 2 or more, those magnets can get stuck and create a connection, a fistula between 2 parts of your intestine as it passes through. Please just only eat food and only eat it through your mouth.
Nurse, sponge.
Unfortunately for the surgeons, operating rooms are kept really warm because the patient's body will leach heat out of any open area. What that means, of course, is that the surgeons really do sweat a lot because unlike SpongeBob, the surgeons are wearing full gowns along with a pair of scrubs, a mask, a surgical cap usually. So while a nurse wouldn't want to wipe down a surgeon's face because some of the water might leak into the sterile field, I have heard of nurses putting alcohol down a surgeon's back, down the back of their gown, because that way they can stay cool but not contaminate the patient.
There we go.
The speed of SpongeBob suturing may seem unrealistic, but if you watch a real surgeon suture, one who's been doing it for 10 plus years, they get really fast. I mean, those stitches just go, go, go.
I finished your nose job, you silly goose. Take a look.
SpongeBob, you idiot! This isn't even close to what I wanted!
Oh, nurse!
Wait, no, I want a different diaper. No! 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 No!
Oh, that's
No!
marvelous.
No! No!
If it were possible to get results that quickly, we would have a lot more people getting nose jobs.
How's about the Squidward Classic?
Hey, not bad. This looks even better than my old nose.
Well, I did have to use a few of your other body parts to resculpt it. No! Look at the time. I have to go to work.
But you're
It's actually not uncommon to take skin from one part of your body and use it to create another part or to repair another part. That's called a graft. Specifically, a skin graft. And it's best to use your own skin because you're unlikely to reject your own skin.
No! Look at the time. I have to go to work.
But you're a doctor. You're at work.
Nah, I'm just a fry cook. But it was fun playing with you guys. Bye.
Fry cook.
Don't be afraid.
That is the exact same reaction that I would have had.
It's so much fun!
Oh, he has hyperreflexia. Hyperreflexia is exactly what it sounds like. Your reflexes are more than they should be. You can also have hyporeflexia, which is when your reflexes are less than they should be, and they signal different kinds of neurological damage. Hyperreflexia, or excessive reflexes, occurs when you have damage that happens in the brain or the spinal cord. And what happens is those nerves that actually go to your knees and your elbows and everywhere else, they are still active, but the inhibitory response from your brain and spinal cord are not there. When that inhibition is gone, the reflexes get greater. So in a way, the reflexes aren't actually stronger than they were before. You've just taken away the part of them that moderates them, that controls them. And this kind of damage is what we see in people who have strokes. They often have hyperreflexia because the brain is damaged and therefore that inhibitory response is gone. Now, if you have lower motor neuron damage, like the nerves that actually supply your arm, you'll have hyporeflexia, or less reflex than you did, because the actual thing that causes the reflex is gone. The inhibitory response from the brain and spinal cord are still there, but it doesn't really matter because you don't have reflexes in the first place.
It's kinda hot in here.
How many x-rays of Mr. Krabs do we need?
Just one. How many did you set it to take?
25,000?
So if you get one X-ray, it has about the amount of radiation that you'd get if you took a cross-country flight. 25,000? That's not great. Excessive radiation puts you at risk for cancer later in life, so you really shouldn't be getting more scans than you need. Now, an X-ray isn't that big a deal, but when you start getting into things like CT scans, the amount of radiation can really add up. So I personally try to avoid doing CT scans or CAT scans as much as possible. But sometimes it's unavoidable. blood vessels look like. Yeah, that is definitely a thing. The ruptured blood vessels, not the flying away into the distance. It can happen if you exert yourself too much. Usually just goes away on its own. Oh dear. So if you're not used to exercising, if you're deconditioned, you should always start slow, because if you exercise too hard while you're deconditioned, you can develop rhabdomyolysis, which is essentially when your muscles start breaking down because of excessive use. People who have seizures can also get rhabdo because they're flexing their muscles during the seizure. But the interesting thing is that in the hospital, when I've treated patients with rhabdomyolysis, they are so miserable because they're just peeing all the time, but I have to make them pee. The way that you evaluate if your treatment is working is whether or not the patient is peeing a certain amount per hour. So usually those patients are peeing all night.
I suppose I won't need to close your restaurant today. See you next year.
Woohoo! We did it, boys!
Oh, God.
The Krusty Krab lives to see another day!
If your physical exam ever leaves you that injured, you need to find a new doctor. Thank you for watching, and if you haven't seen my first SpongeBob reaction, you should definitely go watch that one next. See you in the next one. Bye-bye.